Ever felt like you can't catch your breath? It might be more than just asthma. Imagine being allergic to your own home. That's HP for you. Wonder what causes your chronic cough. HP could be the culprit. Hypersensitivity pneumonitis, or HP, is a mouthful, right? It's a lung disease that makes it hard to breathe. Think of it like an allergy gone wrong, but instead of sneezing, your lungs get irritated and inflamed. This happens when you breathe in something you're allergic to over and over again. Things like mold, dust, and even bird feathers can trigger HP. It's like your lungs are saying, hey, we don't like this stuff, stop it.
Diagnosing HP can be like solving a mystery. Doctors have to play detective to figure out what's going on. They'll ask you lots of questions about your work, hobbies, and home environment. They'll also listen to your lungs and might take an X-ray to see if anything looks off. Sometimes they might even do a lung biopsy, which is like a tiny peek inside your lungs. It's important to be honest with your doctor about everything, even if it seems silly. You never know what clue might help them crack the case.
HP can be sneaky because its symptoms are similar to other respiratory illnesses. You might have a dry cough that just won't quit, feel short of breath, or get tired easily. Some people even get flu-like symptoms, like fever, chills, and muscle aches. It's like your body is waging a war against an invisible enemy. If you notice these symptoms, especially if they come and go or get worse after you're exposed to certain things, it's important to see a doctor.
HP, not as common as a cold, but the good news is that HP isn't as common as the common cold, but it's still a serious condition that affects thousands of people every year. It can happen to anyone, but people who are exposed to certain things at work, like farmers, bird breeders, and factory workers, are at a higher risk. It's like playing a game of chance, but you don't want to be the unlucky winner. The numbers game. Who gets HP? Let's talk numbers. Every year, about 3 to 4 people out of every 100,000 will develop HP. That's like finding a 4-leaf clover in a field of grass. And guess what? Men and women seem to get HP at about the same rate. So it's not picky about who it affects.
Living with HP. What's the outlook? The good news is that if HP is caught early and treated properly, most people can live normal, healthy lives. The key is to avoid the things that trigger your HP. That might mean changing jobs, wearing a mask, or making some changes at home. It's like having a superpower. You just have to be careful about your kryptonite.
Breathe easy. There's hope for HP. HP can be scary, but it's important to remember that it's manageable. With the right treatment and lifestyle changes, you can breathe easy and live a full life. So, don't let HP take your breath away. Fight back and take control of your health. Like, share, comment, and subscribe.